What up, family? This is Brother Tezwan, and I wanted to do a video. Been getting a lot of text messages and uh, DMs on my social media, on Facebook. Um, people asking me questions, and I guess stuff are going out, and people, sending stuff out. Um, some of it is bull, but some of it is actually legit. So what I wanted to do, because sometimes it takes numbers to make people move. So what I did is I went ahead and I printed off all the WHO, which is the World Health Organization's reports that they put out every day at 10 o'clock Eastern Standard Time. Now, these numbers that I'm gonna use for the United States, they're a little off because like I said, the WHO puts out their reports at 10, and the CDC normally doesn't put out their report until 12 every day. So there's going to be a little bit of a disparage, but not to the point where you won't get what I'm saying. So I did a spreadsheet on every day since the WHO started reporting this, which was back on January 21st, where the first numbers came out of China. So I'm gonna hit the high points, and I'm gonna talk about how bad this thing could get. Hopefully, it doesn't get this bad. This is not me trying to scare anybody. I just wanted to put the numbers out there. The way I'm gonna look at it, the way that I did this, I looked at the number for the entire world according to what the WHO has, and specifically for the United States, from when the U.S. started reporting. So, like I said, the reporting started on January the 21st. The first cases were reported in China. At that time, it was 282 cases with 6 deaths, and that mortality rate at that time was 213, 2.13%. 2.13% was the mortality rate at that time. The highest death rate, or the highest death count in a single 24-hour period, was on February the 13th. It was 254 deaths over a 24-hour period. And I really didn't go into it at this point to say where all those deaths occurred at, but that was the highest death count over a 24-hour period. Now, let's go back. The first case that was reported in the United States was 3 days later after the WHO actually started reporting this. That was reported on January the 24th. That was the first case, one case confirmed in the United States, 0 deaths at that time. The highest change in cases over a 24-hour period, from meaning it was one number one day and then it went up by a dramatic amount the next day, was between February the 16th and February the 17th, where it jumped 19,572 inside of 24-hour period. Again, I didn't go into the reports to see where this jump occurred, but that was the largest jump in a 24-hour period since the WHO started recording this. The highest death rate in a 24-hour period was on February 26th, and this again is globally, worldwide. That was 3.35%. So deaths compared to cases, it was at 3.35%. That was the highest. Now, so just real quick, let's talk about the world numbers. Currently, from beginning to March the 12th, the current world daily numbers, we're averaging about 2446 or 2446.39 cases per day. That's how many cases that's occurring per day. So at this current rate, by the end of the year, we got 293 days left in the year. We'll be looking at 716,790. I'm gonna just round it off. 93 cases on December the 31st at the end of the year. So that's total cases, reported cases. If the daily rate continues at that. Now, at the 2446. Now that's with numbers change. That's numbers going flat at several periods across the globe, and it is the current average over the period of time from when they first started reporting to March the 12th. So again, that number, the world cases per day is 2446.39 cases per day. If it continues at that rate, we'll be looking at 716,693. I'm rounding that number up. And approximately 19,393 deaths on December the 31st if we continue at that rate. Now, over the last 7 days in the world, we've been averaging about 4,246 cases a day. So that number has almost doubled over the last 7 days. From where we were at 2446 per day, we're now, over the last 7 days, we're looking at 4,446 cases per day. At this rate, by the end of the year, December the 31st, if this rate continues, we'll be looking at 1,244,162 cases total. So again, that's the rate we're at. If we continue at the rate of 4,246 from here on out, from March the 12th on out, we'll be looking at over a million, almost 1.2 million by the end of the year. And the death count at that point will be 33,661. 662. Now, these numbers are they're just looking at the numbers. They're not looking at, margin of error. They're not looking at change. They're just straight, looking at where end of the year looks at 293 days at this point, compared to the deaths, so on and so forth. All right. So our global death rate from the time when the WHO started, the World Health Organization started reporting this, till March the 12th, we're looking at a mortality rate for the COVID-19 at 2.71%. And again, this is based on the numbers that they have given, and is based since January the 21st, I believe it was, when they first started reporting this, to March the 12th. All right, yeah, January the 21st. So that mortality rate is about 2.71. Now, we'll come back to some other numbers, some really sobering numbers that I want to talk about. But now I want to go ahead and get into the U.S. numbers. All right. So again, the U.S. reported its first case 3 days after the World Health Organization started reporting this on January the 24th, which was the first case. Again, I didn't go into the report to see where it was. I'm just reporting the numbers at this point. I'm only really concerned about the numbers. So, the first death in the United States occurred on March the 3rd. That's the first reported death, according to the World Health Organization, was reported on March the 3rd. All right. The highest mortality rate since March the 3rd was on March the 5th, where we were looking at we was looking at a 9 total deaths, 3 new deaths from a change in 24-hour period. So that was looking at 9 over 21 cases. So it was at a 6.98 mortality rate at that point. All right, and it has tapered down since then to kind of reflect more of what the world numbers have looked like over time. Which is how I got that 2.71 globally. But currently in the United States, our current mortality rate in the United States is literally almost double of that of the world. It's not over the same period of time because you have to start when the first death occurred in the United States, which started on March the 3rd, was on March the 3rd. But we're looking at, since March the 3rd to March the 12th, at a 4.85 mortality rate, which is extremely, extremely high, guys. So the last 3 days have been the highest by far. Not globally, but for the United States. On the 10th, we had a change of 259 new cases. In the death rate, we had 8 new deaths. And then on March the 11th, we had an additional 224 with an additional 6 new deaths. And then on March the 12th, we had a additional 291 and an additional 4 deaths. All right. Now, when you look at the numbers, you see that up until basically March the 3rd, when the first death occurred, that's when the numbers began to explode. Because we were, over a several day period, we were under 100. Up until March the 2nd, up until March the 3rd, March the 3rd, we went into the day at 64, or into the report at 64. March the 4th, we bust 100. We bust 108, actually. So, and ever since then, it has been steadily increasing. And then, like I said, over the past 3 days, it just has extremely ballooned. I mean, just looking at the number, 4 times, the 10th is pretty much 4 times the amount that it was on the 7th. And when you look at the numbers, we had 2 days in between there where we had no new cases, and that could have been just them not reporting, or I don't know the reason why that. I got zeros there. It might have been because it was the weekend. I think that was the weekend. But the numbers for the United States, again, the mortality rate as of right now, from March the 3rd to March the 12th, is currently 4.85%. And again, it's tapering off. Now, in the U.S., from the time we started reporting, which was January, or wait a minute, let's go back up. When the U.S. first started, January the 24th, which was our first case. So from that date, from January the 24th till March the 12th, we've averaged about 20 cases per day, about 20 and a half cases per day. All right. So if we continue at that rate, by the end of the year, we'll be looking at roughly 19 cases. 6,018 cases, 19 cases. 6,019 cases. Let's just say 6,019 because it's a decimal there. So by the end of the year, December 31st, we'll be looking at 6,019 cases with 292 rounded up to 292 deaths in the United States at the 20 cases per day clip. Now, as I've already said, over the last 3 days, we've seen an extreme explosion. So what I did is, again, just like with the world, I looked at the numbers over the last 7 days. And in the last 7 days, the United States has been averaging about 122 new cases over the last 7 days. All right. And at that clip, if that rate continues, 122 cases, going forward out to December the 31st, we'll be looking at 35,913 cases on December the 31st at the end of the year. All right, with about 1,740 deaths. So 1,740 deaths, from now until or when the first death occurred on March the 3rd to the end of the year, December 31st. All right. So, which explains why things are starting to ratchet up in terms of government and local authorities pushing us into a semi-quarantine. I got a call this evening saying that Metro Atlanta has locked down all the schools. I didn't get a whole lot of details, but I do know that my kids' county, which is Clayton, Atlanta, Fulton, City of Atlanta, Henry County, I know those for a fact have lockdown. And from what I was told, and I haven't checked this out for myself, so it may be wrong. I don't know. I haven't checked it out, but from what I was told is that they're indefinite until further information is given. So, and my daughter, I was told, has also had, West Georgia has also extended their spring break by a week. So that's it for now. My local area, my wife checked it today. They haven't closed down the school or anything yet. I really don't like the way Georgia is doing it because they're not really saying where people are in terms of cases. But it is what it is. So those are the numbers right now. They're pretty sobering when you look at them. But I also wanted to touch on a couple other things. This 80-15-5 ratio, kind of, not really a ratio, but this where they're saying 80% of people will be infected, 15% will fall into the hospitalization slash critical slash medical attention group, and then that 5% critical, and that 5% also including that death rate. So what I did, I looked at the numbers for the United States and also looked at the numbers for the world. Currently, there's about 7.53 billion people in the world. So at 80%, 6.02 billion people will be infected by COVID-19. Now, I didn't put a timeline on it because none of the scientists has put a timeline. Now, in regard to these numbers, this 80-15-5, there's no timeline given. It's just the theory that 80% of people will be infected by this disease. All right, so if that holds true and this thing continues to go unchecked and it continues to spread the way it's spreading, if 80% of people on planet Earth are infected by COVID-19 with 7.53 billion people in the world, when it's all said and done, 6.02 billion people will be infected. So, let's talk about the deaths. Let's just say we take that 5% as people that are going to die from this. All right. Now, that's not entirely true, but let's just say it for the sake of the math. All right. Let's say that 5% that will fall into that critical group, all of those people die. We're talking about 301 million people. 301 million people. All right. Again, that's obviously, we're hoping that a vaccine is discovered and it works, and just like the polio epidemic, just like the Spanish flu, just like smallpox, all of these other viruses and diseases that we have somewhat pretty much eradicated through vaccines, this will be the same way. But just looking at the numbers from the outset right now, where we're currently at, where we don't have a vaccine, if we look at the numbers and we say 5% of 6.02 billion people will die, we're looking at 301 million people dying from this disease. All right. Now, the United States currently, And again, these numbers are rough numbers based on the census and, however they collect the data to get these numbers. And I just Googled this, and this is where I got the numbers. So in the United States, there's currently 261,760,000 people, roughly, right? So, no. My bad. I'm looking at what I want to look at, but I'm not looking at what I want to look at. So in the United States, there's 327.2 million people. So 327.2 million people in the total. That's the total amount of people they say are in the United States. All right. So if 80% of the 327 is affected by this disease, that means 261,760,000 will be infected with COVID-19 when it's all said and done over whatever time period. All right. Of that number, of that 327.2, if we're talking 5% again, 5% critical, we're talking about 13 million people. 13 million people. All right, or 13, let's just round it up, 13.1 million people being affected and possibly dying from COVID-19. All right, again, this is the 85-15-5 layout of how this could play out. And it's one of those things where I've seen this 80-15-5 concept out there in a lot of different places in my research, and the science is talking about, what groups fall into what category. All right. So that's a lot of people, man. In either number, when we're talking about 301 million people worldwide possibly dying from this, man, that's life changing. We're talking about 13.1 million people in the United States possibly dying for this. Man, that's life changing. That's life as we know it, as they say. So, I wanted to present the numbers, and I plan on doing this every day. I printed off, I caught up, I printed off all the WHO reports today. Me and my wife went through the numbers, put them on a spreadsheet. Now, what I will say again, just so I'm clear, the numbers for the United States and the WHO numbers are different. And the reason they are different is because the WHO reports their numbers earlier in the day than the United States CDC reports its numbers for the country. All right. So if you go and look at the numbers and you say, oh, those numbers are not right, that's the reason why. All right. Go to the numbers that I'm using for this spreadsheet, for the numbers that I just gave you are from the World Health Organization off of their reports that they've been putting out since January the 21st. All right. And again, man, these numbers are really sobering. They're really sobering when you look at, the increase of cases in the United States. I mean, when I look at the increase of the cases in the United States, I see, and I'm going to go back in the reports, I see a community spread, as they've been saying, happening around the 3rd and the 4th. And what I believe had happened is these people were sitting around, they were sick, they were released or whatever, and it began to spread inside the community. And I'm not a scientist, I'm not a professional at this. I'm pretty good at research and I'm pretty good at numbers. And I've really taken an interest in this because I really felt like when I first started researching this and reading about this, I really felt like this was going to become a problem that got out of hand, and it has. In my opinion, it has got out of hand. I think the world has gotten a grip on it, but I think for the United States, this is a problem that is, as I heard the doctor from the government say yesterday in front of Congress, it's going to get worse before it gets better. I'm just hoping that government does what it's supposed to do and step in and not let this thing get so out of whack like it did at certain points in China and other places in the world that we see and hearing about every day. But like I said, the numbers are sobering, man. That 122 is pretty freaking sobering. That 4.85 mortality rate in the United States is pretty sobering. You know, that 259, 224, 291 over the last 3 days, new cases, is freaking sobering. You know, and you just imagine if we're having that many new cases, you know, in this short period of time, you know, when I'm talking about next week, if I come back and do another video next week, you know, to just curious to see where those death numbers are going to be at that point. You know, I plan on putting this on a bell curve to see, you know, kind of how, you know, certain numbers, you know, level and pan off, and you know, so on and so forth. But that's more the math side, and I probably won't present that. But I wanted to present some of the numbers that I knew was out there, you know, and me putting it on the spreadsheet just made it that much more clear for me. So do what you need to do, man. Stay in the house, wash your hands, do everything these scientists and these health officials are telling you to do, man. Because here in the United States, this thing is about to blow up, and it's just looking at the numbers over the last 3 days. It's clear to me that the balloon is about to get much bigger, and it's blowing up pretty freaking quick. So that's it for now. Peace.